All right, today we're going to go over something for fundamentals, chapter 29, infection, prevention, and control. Get that out of the way. All right. All right, so what do you think infection is? Basically, you have a host it's invaded by microorganisms and they get a disease. What do you think colonization is? So they're in the host and they grow without any tissue invasion or damage. What do you think a communicable disease is? It's a disease transferred from person to person. What does symptomatic mean? You're seeing signs and symptoms. What is asymptomatic? You're not seeing any signs and symptoms. So what do you think is an example of a communicable disease that can be asymptomatic? Hepatitis C, and is most effectively transmitted through like a needle stick. All right, so the chain of infection goes infectious agent. All right, tell me the chain of infection. Infectious agent to reservoir to portal of exit to mode of transmission to portal of entry to host and then back again. So what do you think would be some frequent reservoirs for healthcare associated infections? Healthcare workers, especially their hands, because you don't know where their hands have been. They've been on patients, they've been on equipment, they've been all around. It could be infected. Then you got patients. Again, if they're sick, they can transfer it to people. Then you got equipment. If they don't clean the equipment properly, touch the patient, then that can have it. Then the environment, like a table, if the table's not been cleaned properly or something like that, like it's in the air, you could get it by like that. So what are the two types of human reservoirs? So you got people that have the disease, but they have, if we're short term and they have symptoms with it, then you have people that don't have signs of the disease, but they're also carrying it. So both of these could spread it. So what are some things that organisms might need to survive in life? Could be like food, oxygen, water, temperature, pH, and light. What do aerobic bacteria require to survive? They need oxygen, and anaerobic, they don't need oxygen. What is the ideal temperature range for most human pathogens? (20 to 43 degrees Celsius or 68 to 109 degrees Fahrenheit. What is the ideal pH range of most pathogens? (5 to 7). And we know they thrive in dark environments as underdressings and within body cavities. So what are some examples of a portal of exits? Blood, skin and mucous membranes, respiratory tract, genitourinary tract, gastrointestinal tract, and transplacental, so like mother to fetus. What is the major route of transmission for pathogens identified in the healthcare setting? Unhand-washed hands of healthcare workers. And now we're going to talk about some pathogens. What is the major reservoir for E. coli? The colon. And what are the major infections and diseases that E. coli cause? Gastroenteritis and UTI. What is the major reservoir for S. aureus? Skin, hair, mouth. What are the major infections and diseases that S. aureus causes? wound infection, pneumonia, food poisoning, cellulitis. What is the major reservoir for strep A organisms? Oropharynx, skin, perineal area. What are the major infections and diseases of strep A organisms? Strep throat, rheumatic fever, scarlet fever, impetigo, and wound infection. What is the major reservoir for strep B organisms? Adult genitalia. What are the major infectious and diseases that are caused by strep B organisms? UTI, wound infection, postpartum sepsis, and neonatal sepsis. What is the major reservoir for Mycobacterium tuberculosis? Droplet nuclei from lungs and larynx. What is the major infection or disease caused by Mycobacterium tuberculosis? Tuberculosis. What is the major reservoir of Neisseria gonorrhoeae? GU tract, rectum, and mouth. What are the major infections and diseases caused by Neisseria gonorrhoeae? Gonorrhea, pelvic inflammatory disease, infectious arthritis, conjunctivitis. What is the major reservoir of Rickettsia rickettsii? Wound tick. What are the major infections or diseases caused by Rickettsia rickettsii? Rocky Mountain spotted fever. What is the major reservoir for S. epidermidis? Skin. What are the major infections or diseases caused by Staphylococcus epidermidis? Wound infection, bacteremia. Now let's talk about viruses. We just talked about bacteria. All right. What is the major reservoir for the Hep A virus? Feces. We know it causes Hep A. What is the major reservoir for the Hep B virus? Blood, certain body fluids, sexual contact. What is the major reservoir for Hep C virus? Blood, certain body fluids, sexual contact. What is the major reservoir for herpes simplex virus type 1? Lesions of mouth and skin, saliva, and genitalia. What are the major infections and diseases caused by herpes simplex virus type 1? Cold sores, aseptic meningitis, sexually transmitted disease, herpetic whitlow. What is the major reservoir for HIV? Blood, semen, vaginal secretions via sexual contact. What are the major infections and diseases of HIV? AIDS. Let's talk about fungi. What are the major reservoir for aspergillus organisms? Soil, dust, mouth, skin, colon, genital tract. What are the major infections or diseases caused by aspergillus organisms? Aspergillosis, pneumonia, and sepsis. Alright, what are the major reservoir for Candida albicans? Candida albicans. Mouth, skin, colon, genital tract. What are the major infections and diseases caused by Candida albicans? Candidiasis, pneumonia, and sepsis. Talk about protozoas. What is the major reservoir for Plasmodium falciparum? Blood. What are the major infections or diseases caused by Plasmodium falciparum? Malaria. Alright, so a patient is admitted to a medical unit for home-acquired pressure ulcers. The patient's ulcerative disease and has been incontinent of urine. The nurse inserts a Foley catheter. You identify link infection chain as Foley catheter bag. Alright, what are the stages of the infectious process? What are the 4 stages? Incubation period, prodromal stage, illness stage, and convalescence. What is the incubation period? So pathogen has entered the body and it goes to first appearance of symptoms. That's that. So it's like pathogen enters the body here, and it goes. Okay, what's the prodromal stage? This goes from like non-specific symptoms to a little bit more specific symptoms. What's the illness stage? You're seeing more signs and symptoms, but they're more specific to that type of infection. So like a UTI in older adults, be like you'd see confusion. Then what's convalescence? Like when the acute symptoms of infection disappear. So when an infection becomes localized, as in a wound infection, what do we want to do? Use standard precautions, appropriate PPE, and hand hygiene to block the spread. What is normal flora? Microorganisms in the body. They don't cause disease if they're in the normal area, but they instead participate in maintaining health. So if we use broad spectrum antibiotics for treatment of infection, what might happen? It may eliminate or change normal flora, leading to a superinfection. So what causes a superinfection to develop? So the antibiotics kill the flora, not just those causing infection. And then once they die, the normal ones, the good ones, body defenses are reduced, and that allows the illness to grow, I'm assuming, a lot faster. Now we're going to look at natural defense mechanisms against infection. Look at skin first. So we have the intact multi-layered surface. What's the action of the intact multi-layered surface? It's like the first line of defense against infection. What's the action of it? Provides barrier to microorganisms and antibacterial activity. What factors may alter the defense mechanisms of the intact multi-layered surface? Cuts, abrasions, puncture wounds, areas of maceration. What is the action of the shedding of outer layer skin cells? Remove organisms that adhere to outer layers of skin. What are some factors that may alter shedding of outer layer skin cells? Failure to bathe properly and proper hand washing technique. What is the action of sebum? Contains fatty acid that kills some bacteria. What are some factors that may alter the defense mechanisms of sebum? Excessive bathing. Now let's talk about the mouth. What is the action of intact multi-layered mucosa? Provide mechanical barrier to microorganisms. What are some factors that may alter the defense mechanisms of intact multi-layered mucosa? Lacerations, trauma, extracted teeth. What is the action of saliva? Washes away particles containing microorganisms, and it contains microbial inhibitors such as lysosomes. What are some factors that may alter defense mechanisms of saliva? Poor oral hygiene and dehydration. Let's talk about eyes now. What is the action of tearing and blinking? Provides mechanisms to reduce injuries such as blinking, or help wash away, such as tearing, particles containing pathogens, thus reducing dose of organisms. What are some factors that may alter defense mechanisms of tearing or blinking? Injury and then exposure to like a splash or splatter of blood or other potentially infectious material into the eye. Let's talk about the respiratory tract. What is the action of the cilia lining upper airway coated by mucus? Traps inhaled microbes and sweeps them outward in mucus to be expectorated or swallowed. What are some factors that may alter the defense mechanisms of the cilia lining upper airway coated by mucus? smoking, high concentration of oxygen and carbon dioxide, decreased humidity, cold air. What is the action of macrophages? Engulf and destroy microorganisms that reach alveoli of lungs. What are some factors that may alter defense mechanisms of macrophages? Smoking. Let's talk about the urinary tract. What is the action of the flushing action of urine flow? Washes away microorganisms on lining of bladder and urethra. What are some factors that may alter defense mechanisms of flushing action of urine flow? Obstruction to normal flow by urinary catheter placement, obstruction from growth or tumor, and delayed micturition. What is the action of the intact multilayered epithelium? Barrier. What are some factors that may alter the defense mechanisms of intact multilayered epithelium? Basically catheter and continued movement of the catheter. Talk about gastrointestinal tract. What is the action of the acidity of gastric secretions? Prevents retention of bacterial contents. What are the factors that may alter defense mechanisms of acidity of gastric secretions? Antacids. What is the factors that may alter defense mechanisms of rapid peristalsis in small intestine? Like impactions. Let's talk about the vagina. You can read that one. Okay. What is the process of inflammation? Neutralizes, eliminates pathogens or dead necrotic tissues, and eliminates a means of repairing body tissues. What are signs of localized inflammation? Swelling, redness, heat, pain, loss of function in an affected body part. What are the symptoms of a systemic infection? Fever, increased white blood cells, malaise, anorexia, nausea, vomiting, lymph node enlargement, or organ failure. After tissues are injured, a series of well-coordinated events occur. Inflammatory response includes vascular and cellular responses, like formation of inflammatory exudates, which is like fluid in cells that are discharged from cells or blood vessels, like pus or serum, and tissue repair. Injury causes tissue damage and possible necrosis. As a result, the body releases chemical mediators that increase the permeability of small blood vessels and fluid, protein, and cells interstitial spaces. Due to the physiological inflammatory response, the involved body part may have a temporary loss of function. Cellular response to inflammation involves white blood cells arriving at the site. White blood cells pass through the blood vessels into tissue. With the process of phagocytosis, specialized white blood cells cause neutrophils and monocytes ingest, destroy microorganisms and other small particles. And leukocytosis, or an increase in the number of circulating white blood cells, is the response to the body of which white blood cells leaving. Things like that. Alright, what patients are at greater risk for HAIs? Multiple illnesses, older adults, poorly nourished, compromised immune system. What are some things that can cause a HAI? Invasive procedures, antibiotic administrations, presence of multiple multi-drug resistant organisms, and breaks in infection prevention and control activities. What are some things that can help prevent HAIs? Hand hygiene and chlorhexidine washes. What is a iatrogenic infection? It's an HAI that results from a diagnostic or therapeutic procedure. What's an example of an iatrogenic infection? Like bronchoscopy and treatment with broad spectrum antibiotics. So healthcare acquired infection may be exogenous or endogenous. What is an exogenous infection? It's an infection that comes from microorganisms found outside the individual, such as salmonella. They do not exist as normal floras. What is an endogenous infection? When part of the patient's flora becomes altered and an overgrowth results, as with streptococcus. This often happens when a patient receives broad-spectrum antibiotics that alter normal floras, and then when a significant number of microorganisms normally found in one body site move to another site, an endogenous infection develops. What are major sites of HAIs? Surgical or traumatic wounds, urinary and respiratory tracts, and the bloodstream. So what are some things that may cause HAIs in the urinary tract? Unsterile insertion of urinary catheter, improper positioning of urinary drainage tubing, open drainage system, catheter and tube become disconnected, drainage bag port touching contaminated surface, improper specimen collection technique, obstructing or interfering with urinary drainage, urine and catheter or drainage tube being allowed to enter bladder, repeated catheter irrigations, improper perineal hygiene. What are some things that may cause HAIs in surgical or traumatic wounds? Improper skin preparation during surgery, failure to clean surface properly, failure to use aseptic technique during operative procedures and dressing changes, use of contaminated antiseptic solutions. What are some things that may cause HAIs in the respiratory tract? Contaminated respiratory therapy equipment, failure to use aseptic technique while suctioning airway, improper disposal of secretions. What are some things that may cause HAIs in the bloodstream? Contamination of IV fluids by tubing, insertion of drug additives to IV fluid, addition of connecting tube or stopcocks to IV system, improper care of needle insertion site, contaminated needle or catheters, failure to change IV access at first sign of infection or at recommended intervals, improper technique during administration of multiple blood products, proper care of peritoneal or hemodialysis stunts, proper accessing an IV port. Older adults have a thing called immune senescence. It's an age-related functional deterioration in immune function, increased susceptibility of the body to infection, and slows overall immune response. Older adults are less capable of producing lymphocytes to combat challenges to the immune system, and when they produce the antibodies, their duration is shorter and fewer are produced overall. Poor nutrition, unintentional weight loss, lack of exercise, poor social support, and low serum albumin levels contribute to older adults getting HAIs. Flu and pneumonia vaccines are recommended for older adults, stuff like that. I would just take a moment to read this, focus on it. So what are we going to look at when we do an assessment? Defense mechanisms, susceptibility, knowledge of how infections are transmitted, review of systems like travel history, immunizations, and vaccinations. You need to do a medication history to see like what symptoms may cause it to. So chronic diseases such as COPD, heart failure, and diabetes may lead to what? Pneumonia, skin breakdown, and venous stasis ulcers. Lifestyle and high-risk behaviors such as exposure to communicable infectious diseases, use of IV drugs, and other drugs or substances may lead to what? STIs, HIV, HBV, HCV, opportunistic infections, viral infections, yeast infections, and liver failure. So being a healthcare worker, a minor, unemployed, or homeless may lead to exposure to blood and body fluids, increased risk of infection, black lung disease, pneumonia, TB, poor nutritional intake, lack of access to medical care, and stress. So invasive radiology or transplant may lead to multiple IV lines and immunosuppressive drugs. So sickle cell disease and diabetes may lead to anemia and delayed healing. West Nile virus, SARS, avian flu, and hantavirus may lead to meningitis, acute respiratory distress. Fractures and internal bleeding may lead to sepsis and secondary infection. Obesity and anorexia may lead to impaired immune response. So what are the most common areas of localized infections? Skin or mucous membrane breakdown, such as surgical and traumatic wounds, pressure ulcers, oral lesions, and abscesses. Then, if you can't treat the localized infection, a systemic infection will probably happen. You gotta look for changes in the patient's level of activity and responsiveness, stuff like that. And lab values are not enough to detect infection, surprisingly. All right, now we're gonna go over some lab tests to screen for infection. So, what's the normal value for white blood cells? 5,000 to 10,000. And what would be a indication of infection for white blood cells? Increased in acute infection, decreased in certain viral or overwhelming infections. What is the erythrocyte sedimentation rate of normal values? 15 for men, 20 for women. When is that erythrocyte sedimentation rate elevated? An inflammatory process. What is the normal value of iron levels? 80 to 180 men, 60 to 160 women. When is the iron level decreased? Chronic infection. Alright. What is the normal value of cultures of urine and blood? Normally sterile without microorganism growth. When are you indicative of infection with cultures of urine and blood? You got infectious microorganism growth on it. What are the normal values of cultures and gram stain of wounds, sputum, and throat? No white blood cells in gram stain, possible normal flora. And if you have microorganisms on, that's the positive. What's the normal value of neutrophils? 55 to 70%. When are neutrophils increased? Acute suppurative, which is pus-forming infection. When are neutrophils decreased? Overwhelming bacterial infection in older adults. What are the normal values of lymphocytes? 20 to 40%. When are lymphocyte values increased? Chronic bacterial and viral infection. When are lymphocyte levels decreased? Sepsis. What are the normal values of monocytes? 2 to 8%. When are monocyte values increased? Protozoan, rickettsial, and tuberculosis infection. What are the normal values of eosinophils? 1 to 4%. When are eosinophil values increased? Parasitic infection. What are the normal values of basophils? 0.5 to 1.5%. When are basophil values indicated of infection? During infection, duh. Alright, so this is like diagnosis stuff. So like risk for infection. So don't have it yet, but you have the risks. It's kind of neat. So like this is what you'd see. So like look at the labs. Maybe it's 5,000. And if you remember, if they low, it might be a certain viral overwhelming infection. It's kind of low. Review current meds. They're getting antibiotics and oral anti-diabetic meds. Identify stuff. Okay, easy peasy. So what are some common care goals for patients with infection? What would you say? We want to prevent exposure to infection organisms. Control or reduce the extent of infection. Maintain resistance to infection. And have them verbalize understanding of infection prevention and control techniques. Pretty freaking easy. So this has to do with the cultural aspects of care. You can read this if you like. Alright, so what is health promotion for infection? Preventing an infection from developing or spreading. What is acute care for infection? Treating an infectious process includes eliminating the infectious organism and supporting the patient's defenses. So we take certain measures for systemic infections to prevent what? complications of fever. So we take certain measures for localized infections to do what? To assist removal of debris to promote healing, so like using medical and surgical aseptic techniques to manage wounds, ensure handling of all drainage or body fluids. Okay, what do you think asepsis means? Basically, it's absence of pathogenic microorganisms. All right, so what is medical asepsis? Procedures for reducing the number of organisms present and preventing the transfer of organisms. So after it becomes unsterile or unclean, it's considered contaminated. All right. What do standard precautions apply to? Contact with blood, body fluid, non-intact skin, and mucous membrane from all patients. So, does hand hygiene kill microorganisms? No, it physically removes them. So, tell me some situations in when, if your hands are not visibly soiled, it would be okay to use like hand sanitizer. Before, after, and between direct patient contact, before putting on sterile gloves, before inserting invasive devices, after contact with body fluids or secretions, when moving from a contaminated to a clean body site during care, after contact with surface or objects in the patient's room, after removing gloves. So, what do we know about critical items? They're items that enter sterile tissue or the vascular system, prevent a high risk of infection if they're contaminated with microorganisms, especially bacteria or spores. Critical items must be sterile. What are some examples of critical items? Surgical instruments, cardiac or IV casts, urinary casts, and implants. What do we know about semi-critical items? Items that come in contact with mucous membranes or non-intact skin also present a risk. These objects must be free of all microorganisms except bacterial spores. Semi-critical items must be high-level disinfected or sterilized. And what are some examples of semi-critical items? Respiratory and anesthesia equipment, endoscopes, endotracheal tubes, GI endoscopes, diaphragm fitting rings. So after rinsing and dry items and stored in a manner to protect from damage and contamination. What do we know about non-critical items? Items that come in contact with intact skin but not mucous membranes must be clean. Non-intact items must be disinfected. What are some examples of non-critical items? Bedpans, blood pressure cuffs, bed rails, linens, stethoscopes, bedside tray, patient furniture, food utensils. So what are the steps when it comes to cleaning equipment? Rinse contaminated object with running water to remove organic material. Make sure it's cold. Then we'll wash it with soap and warm water. Then we'll use a brush to remove dirt or material in grooves or seams. Rinse it with warm water again. Dry object and prepare it for disinfection or sterilization if needed. And then clean and dry cleaning equipment. Boom. So what do you think disinfection means? A process that eliminates many or all microorganisms with the exception of bacterial spores from inanimate objects. What do you think sterilization means? The complete elimination or destruction of all microorganisms, including spores. So I have some things in bold right here. I want you to just take a moment and read those, please. So then we got infection prevention and control, protecting susceptible hosts, protecting natural defense mechanisms. Regular bathing removes transient microorganisms from the surface of the skin. Lubrication helps the skin keep the skin hydrated and intact. You may need chlorhexidine wash if you have MRSA or other resistant bacteria. Perform normal oral hygiene. Pretty much it there. What are the most common sterilizing agents that we use in the hospital? Steam under pressure, ethylene oxide gas, hydrogen peroxide plasma, and chemicals. Which one poses a potential health risk to staff, though? Ethylene oxide gas. Tell me what moist heat is. Basically, steam is moist heat under pressure. When exposed to high pressure, water vapor reaches a temperature above boiling point to kill pathogens and spores. What is an example of moist heat? Autoclave sterilizes heat-tolerant surgical instruments and semi-critical patient care items. So tell me about chemical sterilants or high-level disinfectants. So you got like alcohol, chlorines, formaldehyde, blutaldehyde, hydrogen peroxide, iodophors, phenolox, quaternary compound. Do you use for a specific purpose? What's an example of chemical sterilants? Chemicals disinfect heat-sensitive instruments and equipment such as endoscopes and respiratory therapy equipment. Tell me about ethylene oxide gas. Gas destroys spores and microorganisms by altering metabolic processes. Fumes are released within an autoclave-like chamber. Eto gas is toxic in humans, and aeration time varies within products. What's an example of Eto gas? This gas sterilizes most medical materials. Tell me about boiling water. Boiling is least expensive for use in the home. Bacterial spores and some viruses resist boiling. It is not used in healthcare facilities. So, like, boiling is commonly used in home for like urinary catheters, suction tubes, and drainage collection devices. Now, I would like you to read this too. Each of them go with a certain point on here. Please do that for me. Read this too, please. So, what types of conditions or infections need airborne precautions? Measles, chickenpox, disseminated varicella zoster, pulmonary or laryngeal tuberculosis. What are the barrier protections for these types of conditions? Private room, negative pressure room, mask or respiratory protective device, and like the respirator. What types of infections or conditions require droplet precautions? Diphtheria, rubella, streptococcal pharyngitis, pneumonia or scarlet fever in infants and young children, pertussis, mumps, mycoplasma pneumonia, meningococcal pneumonia, sepsis, pneumonic plague. What are the barrier protections for these? Private room or cohort patients, mask or respirator required. What infections or conditions cause contact precautions? VRE, MRSA, C. diff, Shigella. What are the barrier protections for these? Private room or cohort patients, gloves, gowns. Patients may leave the room for procedures or therapy if infectious materials contained or covered, placed in a clean gown if hands are cleaned. What infections or conditions cause protective environment? Allogenic hematopoietic stem cell transplants, and what barrier protections do we use? Private room, positive pressure room, HEPA Filtration for incoming wear. Mask worn by patient when coming out of room during times of obstruction in area. And read the standard precaution stuff, please. What types of principles, regardless of isolation system, do all isolation policies follow? Hand hygiene, entering and leaving. Dispose of all supplies and equipment without spreading. Know the disease and how it is transmitted. Protect all people entering and leaving the room. Read this bad boy. I bet you we're going to have some questions about putting on a mask. So keep it there. I would read this too. Read this. Read this. Read this. Read this. Understand. Read this. This too. This too. This. This too. And this.